Tonight's big story is all about a growing outbreak at a Portland homeless shelter. Now, as of tonight, 20 people are sick. Dozens more are stuck in quarantine. One person is in the hospital, and the timing of this is really important, and it's important for two reasons. Number one, staff at the shelter learned about the first cases of COVID on Thursday, hours after their big Thanksgiving celebration. Now, they tailored that event there to meet all the standard COVID protocols, but still, we're talking about a lot of face-to-face interactions there. Now, number two, as you know, it's getting colder and colder outside. And the closer we get to winter, the more our leaders are going to be trying to get people who are living on the streets here in Portland off the streets and inside somewhere warm where they can take shelter. And it's all happening during a pandemic. Here's Maggie Vespa.
Dozens of residents and staff members here at Portland's Union Gospel Mission are just quarantining and waiting amid a growing COVID outbreak. A spokesperson told us what started with about 4 or 5 cases of COVID-19 last week has now ballooned to 20, and one staff member is in the hospital.
It's rough, and as you can imagine, I think emotions are up and down.
Courtney Dodds is the spokeswoman for Portland's Union Gospel Mission. She's also in quarantine herself amid the growing outbreak at the downtown shelter.
We are supporting each other as best we can, praying a lot.
It all started when 4 or 5 residents tested positive for COVID-19. It happened last week.
We found out on Thanksgiving evening.
Thanksgiving evening, hours after this scene played out front.
Happy Thanksgiving. Happy Thanksgiving.
Thank you so much.
Thursday, hundreds lined up in front of the mission for a hot Thanksgiving meal to go, a pandemic-friendly alternative to the shelter's annual sit-down banquet. Dodd says staff don't believe this event fueled the outbreak. Rather, the residents exposed are members of Life Change, the mission's inpatient addiction recovery program. Dodd says they all have mild symptoms and are quarantining here. All other operations within the shelter have shut down. Staff also closed other facilities, including the mission's thrift store in Tigard. All this in mind, Dodd says directors are confident in their ability to stop the spread. And she also notes that employee who was hospitalized is doing better.
We had a long phone call with the Oregon Health Authority and Multnomah County Health Department yesterday, and they affirmed that we're doing what we should with how we're handling things.
County health officials would know they've had more practice than the public realizes.
Is this the first outbreak at a shelter in Multnomah County thus far?
I would say no. We've had outbreaks in all kinds of congregate settings.
In light of this outbreak, I spoke to Multnomah County Health Officer Dr. Jennifer Vines and Mark Jolan, Director of the Joint Office of Homeless Services. They point out among people experiencing homelessness in Multnomah County, infection rates have remained relatively low. 82 people who identify as homeless have tested positive. Early on in the pandemic, officials feared that number would be much higher.
That's why we have focused on making sure that we can remove the people who are particularly high risk out of congregate shelter settings into motel rooms, and spacing out those folks who are still in congregate settings as much as possible.
Officials believe those tactics have worked, which is why they plan to keep employing them as it gets colder. Right now, they're busy securing extra severe weather shelter sites so that when temperatures drop below freezing, they can bring more people inside while keeping them socially distant. That said, Dr. Vines points out general infection rates are surging, and keeping COVID out of any setting is getting harder.
We do have the power to change the trajectory of this virus. It is exquisitely sensitive to individual human behaviors. And so I don't want to make it sound like it's inevitable. That said, we're at such high levels of community transmission at this moment that unfortunately I'm not surprised to see outbreaks.
Maggie Vespa, KGW News.